A very good morning to the panel of evaluators and everyone. My name is Sin Yee, and today I'll be presenting the abstract for my study, which is the perceived stress of COVID-19 towards the burden of care and psychological distress among caregivers of hemodialysis patients. This is the content for my presentation. First of all, for the introduction, I would like to share what is end-stage renal disease. End-stage renal disease is known as the last stage of chronic kidney disease, where patients diagnosed with ESRD often in need of renal replacement therapy, either in the form of dialysis or kidney transplantation, in order to ensure their survival and well-being. And who is defined as an informal caregiver? They are those who tend to patient on day-to-day basis and supporting the patient physically, emotionally, and socially without being compensated for their effort. Past literature has stated that provision of care for hemodialysis patients often have detrimental impact on the caregiver's life, such as an increased level of care burden, anxiety, and depression. With the adverse of the COVID-19 virus in Malaysia, drastic changes in caregivers' lifestyle can be observed. Sosa et al. In 2021 reported that caregivers in Portugal were burdened with extra responsibility, such as daily disinfection of their houses and groceries, along with being extra cautious with the patient's personal hygiene in order to increase their sense of control and minimize the contamination with the virus. Studies related to caregiving for ESRD patients during COVID-19 pandemic have been conducted in overseas, such as in Iran, France, Portugal, and India. However, in Malaysia, despite the COVID-19 situation in our country, there's still lack of study focusing on COVID-19 perceived stress towards the psychological well-being of ESRD caregivers population. As far as we have known, there's no study have been conducted in Malaysia pertaining the COVID-19 perceived stress towards their burden and psychological distress among the ESRD caregivers population, as most of the COVID-19 related study focus among general population, healthcare workers, and university students. Therefore, there's a need to emphasize and examine the COVID-19 perceived stress towards the psychological well-being among caregivers caring for hemodialysis patients. The aim of this study is to examine the association between perceived stress related to COVID-19, burden of care, and psychological distress among the caregivers of hemodialysis patients. This is the conceptual framework for the study. This was a cross-sectional study conducted among 4 government hospitals, mainly HUKM, HKL, UMC, and Hospitals Layang, along with 8 other private dialysis centers in the Klang Valley. 125 caregivers of hemodialysis patients were recruited purposefully, and they were given a set of questionnaire consisted of perceived stress scale of COVID-19, Zarit burden interview, general anxiety disorder, and patient health questionnaire. The data obtained were analyzed using descriptive statistics, Pearson correlation, and multiple linear regression. As for the inclusion criteria, the participants have to be the primary caregivers to a hemodialysis patient in the respective study site, aged 18 years old and above, have the experience of accompanying the patient to dialysis treatment at least once in a month, and have the ability to read and communicate in Bahasa Malaysia. As for the exclusion criteria, former caregivers, caregivers to patients who have undergone peritoneal dialysis or kidney transplantation, as well as caregivers who are exhibiting severe symptoms of mental illnesses were excluded from the study. This is the analysis for the demographic details. Based on the study, we can see that the mean age in this study stood at 43, with standard deviation of 13.43, with majority of the respondents were in the age category of 30 to 39 years old, with most of them were female. This study is also predominant by Malay participants, and majority of the study respondents were spouses to the patients. Based on the result from the descriptive statistic, most of the participants possess moderate level of COVID-19 perceived stress and minimal to moderate level of care burden. As for the anxiety and depression, majority of the respondents reported to have minimal levels. According to Pearson correlation analysis, COVID-19 perceived stress has statistically and positively correlated with care burden, anxiety, and depression at significant level of 0.001. As for the multiple linear regression analysis, COVID-19 perceived stress has significantly predicted anxiety, care burden, and depression at p-level of 0.001 after adjusting for other confounding variables such as age, gender, and caregiving relationship. Based on the result, it suggested that perceived stress due to COVID-19 was significantly associated with care burden, anxiety, and depression among caregivers of hemodialysis patients. Similarly, the current study is aligned with past study conducted in France and in India. In France, the study reported that 1 in every 3 caregivers had anxiety symptoms, meanwhile 1 in every 5 caregivers had depressive symptoms. Whereas in India, Sharma et al. In 2021 reported that there's a high prevalence of stress, anxiety, and depression, along with insomnia, among the caregivers of children with kidney disease during the COVID-19 pandemic. Therefore, healthcare authorities and policymakers may play a larger role in mitigating the distress felt by caregivers through some interventional program to strengthen their stress management, as well as to provide social and psychological support in reducing their care burden. In conclusion, this study indicated that perceived stress attributed to COVID-19 remains an important factor associated with the caregiver burden and psychological distress of the caregivers caring for hemodialysis patients. These are the references used in my presentation. And that's all from me. If anyone has any question, do email me at the address shown in the slide. Thank you. Have a good day.